SGLT-2 inhibitors. These are medications like Jardiance, Farxiga, Invokana. Those are the main ones that are out there at this point. These are oral diabetic medications that work by interfering with the system that we have in our kidneys for holding on to sugar. The kidneys are a filtering system. Blood flows through them, and the waste makes its way into the urine, and all the things that our body needs stays in the blood. And that's an oversimplification, but all that's basically what ends up happening. Part of what the kidney actively works to keep in the blood is sugar. Sugar is energy. We want to hold on to that energy and use it in general. Obviously, in the case of diabetes, we have too much of it floating around. The medication blocks that mechanism so that it can't keep the sugar in the urine, it can't keep the sugar in the blood, and then the sugar is excreted through the urine. Your body is consistently getting rid of sugar in a way that it normally wouldn't do. So that's how it helps your blood sugar kind of in a consistent, even pattern. Sugar is also calories, so your body gets rid of calories in a way that it normally wouldn't. So that's in part how it has a weight loss benefit to it. It doesn't affect appetite or gut, and it doesn't have any kind of GI-related symptoms or effects. Now, the other thing it'll affect is how you handle fluid and electrolytes. So when sugar passes through into the urine, it's going to take water with it. As water leaves, electrolytes, will transfer and leave as well. So it acts somewhat as a diuretic or a water pill. It can lower blood pressure. In addition to, it's a good medication type for treating diabetes because it helps with weight, it helps with blood pressure. These medicines have independently been shown to, after the fact, being brought to market for diabetes. We've found that they've actually been independently helpful for treating people with congestive heart failure and preventing the progression of chronic kidney disease. Now, that often accompanies type 2 diabetes, but even independently of diabetes, these medicines can do that. So they really have a lot of potential benefits. Right now, being February 2026, they're not generic medicines. They're branded, so they can be expensive. Insurance is important. As far as medical side effects, things to worry about. So when your body's putting more sugar through the urinary tract, you can increase the risk of infection in the urinary tract. That's probably one of the biggest things, and that's bacterial infection or fungal infection. This can happen to men and women. Women are more common. These kinds of things happen more commonly to women because of anatomic differences. So these side effects will happen a little more frequently in women. The other type of side effect relates to the fluid and electrolytes. If you have a relatively small amount of water and electrolyte changes because of this, okay, no big deal. If there's a lot of it, if you're becoming dehydrated, your blood pressure's dropping, you're having changes in your electrolyte levels, that could be dangerous. It's a kind of medicine that you have to think about, how much do I expect this to happen? Do I expect a little bit of sugar to pass through the urine? Do I expect a lot of sugar to pass through the urine? the larger amount, the higher amount of sugar that I expect is going to pass, the more likely you're going to run into side effects and safety issues. Um, so, uh, and that can correspond mostly to where you're starting, where are your blood sugars. If you're, we want our average to be at least under 150, which is an A1C under 7%. If you're in the 180s, okay, you're a little high. Adding this, is helpful, safe. If you're over 300 most of the time, okay, now, that could be a dangerous situation. As a kind of general rule of thumb, I don't like to start these medicines on patients when their hemoglobin A1C levels are higher than 9% or so. That's not, you know, uh, uh, there's no specific evidence about that. That's just sort of a general cut point. Um, yeah, those are kind of the main issues. These medicines are made for type 2 diabetes. They Some medicines for type 2 can be used in type 1. This one in particular, you want to be careful and probably avoid that. And that's because they will increase the risk of having a serious complication called ketoacidosis. It can happen in type 2s with these kinds of medicines, but it's not nearly as common. So that's another small piece of information. So in general, this kind of medicine for type 2 diabetes, Farxiga, Invokana, Jardiance, Farxiga, probably the top two. Invokana, not as much, but that's also out there. These medicines are part of the initial group of medicines that I'm usually thinking about when I'm treating type 2 diabetes. How can I help people lower their blood sugar, lose weight, improve blood pressure, reduce stress on the kidneys? So it is a good group of medicines. Again, every medicine has a side effect or safety issues, and so that's, we've talked about those. So yeah, that's a summary of where that stands.